Talk about the unfortunate, sad state of retirement in America. If you're wondering why I'm able to talk about this, well, my name is Ed Weir. I ran the third busiest Social Security office in the country, and I've helped hundreds of thousands of people with their retirement at that particular time in their life 62, 65, 70 years old. I've taken hundreds of thousands of retirement claims, talked to people about their retirement and what they're going to do now, and I've heard a lot, and I've helped millions of people out through this channel. And so we're going to talk about that today. We were going to talk about Medicaid enrollment period, a little bit of a scheduling conflict there, so we're going to talk about that tomorrow. But if you have any questions on all things Medicare, and because this is a live Q&A as well, so put your type your questions into the live chat down there, and I will get to as many as I possibly can within the hour. All right, and what propelled me to do this is to talk about this. Well, let me pop this up. It's an Onion article. Onion, it's always good. Comedy always seems to kind of go through reality and tell us about what's actually going on out there. George Carlin is always good for that. Old Richard Pryor and all the rest of it. But it's kind of Onion's kind of a satirical kind of magazine, and they said the report was most Americans have enough to save for absolutely an incredible single day of retirement. And they go through here and says whether you choose to spend that day renting an RV to explore one or two different states or swimming with a dolphin at an aquarium, Americans generally have enough of a nest egg squirreled away from decades of saving to enjoy retirement from dawn into the wee hours of the morning before the money finally runs out. And then an addendum to the report noted that most Americans under 40 only had enough saved for so half hour of retirement. And yeah, it's kind of funny the way they put it, but unfortunately, it's not funny the way that it is a reality because I've talked to too many people. And what are we talking about here? Why don't we have enough for retirement? Well, if you look, I could throw up a lot of statistics and charts and all that kind of stuff, but you can go and type in Google, and you can see the stagnant wages. So basically, up until the early 1980s, the American workforce, they really efficient in terms of productivity. Their productivity went up, and you can see it just goes up and up and up. And because productivity goes up, wages went up. Starting in the 1980s, that started to separate. Productivity continued to go up and up and up, but our wages for regular people, the median worker, pretty much flat. So, as adjusted for inflation. So, wages pretty much since the 1980s have been stagnant. There's obviously, don't have to tell y'all, all the jobs being outsourced outside the country. And you also, and not only talk about the macroeconomic type of issues, are also talking about your issues. Divorce. A lot of people had money and then they go through a divorce or they get sick, have to send their children to college and university or accidents or whatever the case may be. And then we got the market crashes that used to be, once in a lifetime market crash, seems to be happening every 10 or 20 years now. And so the people that are doing well are doing very, very well. And the rest of the people, not so much. Um, so a lot of people don't have money saved away for retirement, unfortunately. And so they are pretty much depending on Social Security. It's estimated that about 40% plus of people in America that are currently retired are depending on Social Security benefits alone. 40% are benefits, Social Security benefits alone. You know, Drive that home, please. But one of the problems there is they work all their life in hard jobs. They don't get a lot of, didn't get a lot of money, don't have no savings. And then they have to, when they turn 62, 65, they have to navigate the Social Security system and they're paranoid, rightly so, if they're getting all the benefits they're entitled to. The system is a nightmare. I can tell you from the inside, it is. It's way, way too complicated, more complicated than it should be. Over 20,000 pages of policy. But there's supposed to be people there at the Social Security Administration to help you. The customer service representatives, customers, claim specialists, they're supposed to be there. My office had close to 100 people, 100 staff, and they're supposed to be there. You paid for that help. When you paid your FICA taxes all of those decades, FICA includes Social Security and Medicare, but the Medicare portion that was go to your retirement. Or if you're unfortunate, if you had a tragic accident or illness, then it would go for your disability. If you need a disability, it would go for your survivor benefits. It would go for your children. It would go for spouses. Um, and a percentage of that you paid into all of those decades, about 1.2% of that, goes into providing help when you needed it. But unfortunately, Congress has decided, because they're trying to there are certain elements of Congress or politicians trying to destroy Social Security. So they're playing the long game by, talking about how bad it is, and all the money is stolen. And I've talked about this all the time, and I'll do it again. More than happy to do it again. It's not stolen. The trust fund is still there, but the problem is that the Social Security Administration is at a 50-year low, and they are barely keeping above water. Pretty much, well, actually, they're kind of drowning right now. So they want to be there to help you, unfortunately, but they're not being supported, and they're not giving the resources that you told Congress to give them to help you. That's why I'm doing these YouTube channel, these videos, and in a minute here, I'll get into a live Q&A, and we'll help you out as much as possible. So the help is supposed to be there. I'm not supposed to be here on YouTube helping y'all get your benefits. Social Security, you already paid for that help, but you're just not getting it. So I've got a petition in the description below, and I'll post it as well. There's one petition that you could please sign to tell your politicians to support Social Security, and another one is it's been 21 years since they tried to privatize Social Security, and they're trying it again. So there's going to be a bill to privatize Social Security coming out in January. So we need to activate on that to make sure it doesn't happen. So I've got a petition down there to stop the privatization, and the recommendation is that everybody pays, pretty much everybody that's watching this pays FICA on all the money they make. If you make over $176,100, you no longer pay FICA Social Security tax. And that's one of the reasons the trust fund is running out, and we're going to have issues in the future. All right. So you need help navigating the bureaucracy, whether, the issue is, if you're just early, just want to file for retirement at 62, you need to check your earnings record. Do you want to actually file at 62? Should you wait till 65 or 67 or 70? There's a lot of questions there. Should you be filing for disability instead? Should you file for spouse benefits, independently entitled to spouse benefits, whatever the case may be? So there's a lot of questions out there. So my mission is to help you get your money and make sure it's your check doesn't stop, essentially. But in terms of the sad state of retirement, that is definitely a reality. If it's not for you, congratulations. But it's also, a certain amount of luck. You might have hundreds of thousands of dollars and millions of dollars, but remember that one time you were driving, 3 years ago and going through the intersection? Just so happens maybe someone else didn't stop at the red light. It could have all changed for everybody. So we are here, and it's just pure luck in a lot of cases. So, all right. Let's go ahead and get into all of your questions. And again, I'll talk about, if you came here about the Medicare stuff, I'll be more than happy to talk about Medicare enrollment and periods. But we had a bit of a scheduling issue. I think it was all my fault. But anyway, let's go ahead and jump in there and see what kind of questions we have. Who can we contact to eliminate the Social Security cap? Yes, your politicians do sign the petition. Call your two senators, your House of Representative, Congressperson. Call them up and say, "Hey, we need to end the cap." And let me go ahead and throw that graphic out there for people that are new to the channel. So basically, the cap. A lot of people don't realize this. If you make this is for 2025, if you make under $176,100, you pay FICA, Social Security FICA, on every dollar you make, 6.2%, and then your employer matches at 6.2%. Unless you're self-employed, then you pay both. But after you make over $176,100, you don't pay Social Security FICA anymore. So if you're making, $50,000 a year, you're paying 6.2, and then, the other 6.2. If you're making $5 million a year, you're paying, was it 0.44%? If you're making $10 million, you're probably, paying less than 1%. But usually the people that make $10 million, they don't get wages or income. They take their revenue, they take their assets and go to a bank and get a loan, so they never have to pay taxes. But that's another thing we need to address, and I'm not going to talk about that today. But anyway, so if we raise that cap, if we got rid of that cap and everybody paid the same percentage of their income, net income for business or wages, then we wouldn't get the cuts that are going to be happening here in a few years. So please reach out to your politicians, sign the petition, and I'm going to talk about a little bit more stuff we can do in the next few days. I need your help. So probably Thursday or Friday, I'll talk about that. Nadine, he can't receive spousal benefits until he's 62. Okay, so Penelope is here. Awesome, Penelope, always giving out excellent information. Yeah, spouse benefits. You have to be 62 if that person is out there alive and kicking. Surviving spouse benefits, you can get at 60 years old. All right. What is the best thing we can do to eliminate the cap? Is to reach out to your politicians, but it's going to be an upside. It's going to be an uphill battle because pretty much all the next administration. I mean, I don't want to blame the next administration because they're not there yet, even though they were there 4 years before. It's all their fault. It's Trump's fault. It's Biden's fault. It's Obama's fault. It's Clinton's fault. It's the Bush. It's Papa Bush. It's all of their fault. All of Congress should have addressed the issue with the coming cuts in Social Security. They should address this. They should have addressed this 10, 20, 30 years ago, but they dropped the ball. And we unfortunately dropped the ball because we should have poked them with a sharp stick to make sure they did their thing, but they didn't. And that was a concerted effort to kick the can down the road, unfortunately. So, and now there's no more road to kick the can down. Let's see. I had a call with you 11/7 to clarify, does a disabled widow entitled to my disability and also 71.5% of my husband's survivor benefits? It seems that SSSB is only trying to pay me about 1/3. So, all right. So disabled widow's benefit, a disabled widow benefit is if you were married to someone, they passed away, and you are disabled between the ages of 50 and 59, you can get disabled widow's benefits on that particular person's work record, and you get 71.5%. I'm not sure why they're only talking about 1/3, unless you're collecting benefits on your own record first. And then what they'll do is you'll continue to get disability on your own record. And then the difference between the two for a total of 71.5%. If that's the case, then yes, you always get, money based on your own work record first. And then as a disabled widow, same thing as when you file for spouse benefits, you file for benefits on your own record first, and then the difference between the two from your spouse. But if that's not what they're doing, if that's not what it is, you have to go ahead and get a decision, because right now, someone says, okay, here's your benefit amount. It's not an official decision until you get that award letter. And when you get that award letter, then you can file a reconsideration, SSA 561. But until you get that letter in the mail with the official decision, it's just some Social Security employee saying this, that, or the other. It's not an actual decision. So if they are adjudicating your claim, if they're processing your disabled widow benefits, they have to check and make sure you're disabled within the 7 years, and there's different criteria. And if they approve you, then if the numbers are incorrect, definitely check and file that reconsideration. Thank you for all you do. I have learned a lot from listening to you and have been able to help others. There we go. That's what I like. I like that second part where you are able to help others. This is a team effort. I can just sit here all day and I'm not going to help anybody if nobody watches, and particularly if nobody, shares that information that they learn. So thank you for helping others. And please share, subscribe, like, and all that kind of stuff so we teach this algorithm what it's all about. Does SSA keep SSA 1099 forever? They claim I didn't pay back overpayment from 1976 77, and I paid for several years and years on that through 2014. I only have a 1099 from 2013. Um, yeah, well, they don't keep the 1099. That would be the IRS, and I don't think the IRS keeps it that long. I'm not sure how long they keep it. But in terms of Social Security, if you've got an overpayment from the 70s, yeah, that's going to be difficult. Um, yeah, to check. But again, if you have an overpayment, you can do the SSA 632, request a waiver of that overpayment, said, hey, this was, decades ago. You can't prove it. You don't have documentation that I didn't, so I would definitely check that out. So you can do a SSA 632 to ask to waive it, or an SSA 561, a request for reconsideration to the Commissioner of Social Security was supposed to kind of streamline the overpayment process based on Anderson Cooper's 60 Minutes expose, and they've done a lot to help out overpayments, but yeah, they still need to do a little bit more. Um, okay, yes, someone's given advice to other people on how that we can get active and get this stuff done. If you have a supplement plan C, can you switch easily to another one under age 65? Okay, a plan C. So a plan C. So you're probably talking about a Medicare Part C, and I hate that word. I hate that with what that how they call it, the Medicare Part C. So Part A covers your hospitals, and that's free, or it's zero premium per month. Nothing's free, right? We paid for it, when we paid FICA. But it's zero premium per month. That covers your hospitals. Part B covers your doctors, and that's the one for next year is $185. Part D, as in drugs, is the drug plan, prescription drug plan. Part C in the middle there, that's the Medicare Advantage plans. And by calling it Part C, it seems like it's part of regular Medicare, so I don't like calling it Part C. It's when you get into a Medicare Advantage plan, you're essentially giving up original Medicare, and you're, giving all your health care to whichever company you pick. I think your question is, if you currently have a Medicare Advantage plan, and when you're under 65, can you switch to a Medicare supplement like a Plan N or a Plan G? It depends on your particular state, unfortunately. Some states, they allow you to do that. Most states, they don't, because the insurance companies don't want to give it to you, because if you have Medicare and you're under 65 years old, that means you're on disability, and you're probably going to cost the insurance company a lot of money, and so they don't want to pay that money. So you know, they the states don't force them to provide that. But when you turn 65, then you're in that perfect opportunity, that window to switch from a Medicare Advantage plan to a Medicare Supplement N or G and go back to original Medicare. And there is no health underwriting. They don't charge you extra or anything like that. So, but reach out to Chapter there, and it depends on your particular state and your situation. If you move and different things, if you had a Medicare Advantage plan, there's about 1.8 million plans that were canceled. People's plans that were canceled um, for this year, for 2025 plans. And I know there's going to be a lot of people in January that go to the doctor and they show them their, Medicare Advantage card, and the doctor, the person at the front desk, and say, hey, this is, this no longer active. This has been, this plan is canceled effective December 31st or whenever. So if you know anybody, make sure they review their plan, call the company and ask if it's still active. Go online. You can reach out to Medicare, Chapter Medicare there, and they can check. Yeah, there's a lot of people that could be surprised. And then there's another enrollment period coming January, February, March, where you can change your plan one time. But I'm going to have Thomas from Chapter here tomorrow to talk about that. All right, Vicky. On SSDI, my 2 years to Medicare is up in August. I really wanted to get a supplement plan with D and N, along with A and B, of course. I also turned 65 on November 2025. Okay, great. So August. So yeah, you're in an interesting situation. It depends what state you're in. You're probably stuck with a Medicare Advantage for August and September. And then you can get a Medicare supplement starting November. So yeah, it's crazy, right? So because the companies are not going to give you one for those 2 months. But it really depends on your particular state, and there might be exceptions, but I don't think so. You might have a Medicare Advantage for a couple of months, but reach out to someone you know and trust, or reach out to Chapter, and they'll be able to help you out when that happens. Um, I have a medical history that would most likely preclude me from getting the supplement plan I feel comfortable with. Yeah. But yeah, it really, if you've some companies in terms of Medicare supplement, they're easier, for health underwriting. If you're 65 or you're new to Medicare Part B, then, you're good. You can sign up for any Medicare supplement plan. Energy is what 99.9% of people enroll in nowadays. Um, but if you're outside of that and you need to go through health underwriting, some companies only look back, like, if you have, heart issues, or, you had cancer or something. Some companies only look back 3 years, or some look back 5 years. So it really depends on that particular company. So, Social Security recipients are the cavalry during a Great Depression. They will pour money into our local economies to keep up employment. Yeah, yeah, that's a lot of people. It's not only helping the people that need that money in retirement. Those people don't hoard their shit. So there's people that receive Social Security do not hoard that money. Like, was it Scrooge McDuck? They spend it in the local economy. So yes. Um, Dang it. What is my best move to get in the right time to get the supplement plan I need? Should I wait? Can I wait? Crux is getting the plan without a medical review. Yeah. Again, it's that's why I'm having Thomas tomorrow. It's each state is a little bit different when we're talking about Medicare supplement plans. They're all the same with Medicare Advantage, because Medicare Advantage is a national type of program. It's but the particular plans are local, but the enrollment periods are dictated by CMS, the Center for Medicare and Medicaid Services, which I guess Dr. Oz might be taking over. And anybody that has ever watched the Dr. Oz show knows that he is a big, big, big proponent of Medicare Advantage. He wants essentially a Medicare Advantage for all type of situation. So I'm not a big fan of Medicare Advantage because of the two issues. There's, the pre-authorizations and the limited networks. If he solved those two issues, then I guess, yeah, it would be that. But then that would just turn into the Affordable Care Act. So, all right, a lot of people have been signed. Yeah, Wanda. Yeah, thank you, Wanda. I think she was. Is this the Wanda that told me to make the petitions? And yep. So thank you, Wanda. My daughter gets SSI. Can she collect off her dad's Social Security? Um, yes, if her father is currently receiving retirement benefits or disability benefits, absolutely. Well, if the child is under 18 years old, yes. Or if over 18 years old, if the child became your daughter, disabled adult child, it's called, under disabled under the age of 22 years old. So those three, the parent has to be receiving retirement benefits or disability benefits, and the child has to be under 18 or disabled before the age of 22. If so, then yes, immediately call Social Security and set up an appointment. Unfortunately, that's another way that the politicians are trying to destroy Social Security, by choking it and drowning it in the bathtub, by giving it no resources, so they are not able to help you out. So if you call, you're probably not going to get an appointment for a month or two or something. So, um, Nancy, I really appreciate Dr. Weir, everything he does. I share and also tell others people about it. All right, you're awesome. Thank you very much. Um, it is not fair that people make over the cap do not contribute to FICA, but yet collect Social Security when they're at retirement age. There should be no cap, period. Yeah, I agree. And that's one of the arguments on the other side. They say, well, if people making $1 million, $10 million also pay into it, then their benefits will be so high it'll kind of offset it. No, the proposal is that that also is capped, because for the rest of it, we've had a family max where there's a cap on how much could be paid out into the family. We've had that for decades, um, and so and also what a lot of people don't realize is that Social Security benefits are let me throw this up here. Social Security benefits are separate. People get different benefit amounts based on how much they actually paid into the system. So if you're a low income wage earner, then you get a 90% replacement rate. So the replacement rate is to replace what you earned while you're working throughout your life. And let me get rid of this thing here. Um, so Social Security, how they calculate the benefits, they do it by the average index monthly earnings. So they take all your earnings throughout your life and they look at the high 35 years. It's always the high 35 years. And then they index them for kind of like an inflation to bring them up to essentially kind of today's dollars. And they say, okay, this person throughout their life, they made an average of $1,000 per month. So $1,000 per month. Wow. They were, they definitely don't have any savings or 401ks or pensions and stuff like that. So what we'll do is we'll give them 90% replacement rate. So they'll get $900. On the other end of the scale, if your average earnings throughout your life was $10,000 a month, then you're only getting a 35% replacement rate. So these bin points have been around for decades and decades and decades. And this is one of the things that there's a bill in Congress that's about to go up to the Senate to give about 3% of government, local and state government workers, firefighters, police, cop or teachers, um, basically extra benefits because they paid into Social Security, but their main jobs did not pay into Social Security. And the idea is to give them, maybe 90% because they're low income wage earners, but they're not low income wage earners. And so this bill going through the Senate, it passed the House, and it looks like it might just pass the Senate and it might be signed by the president. And if it does, it's going to, $190 billion present, early Christmas present to people that, yeah, that extra percentage wasn't intended for. Is the current system, you know, great? The windfall elimination and all the stuff that no, it should be recalculated, but it can be recalculated based on, today's computer system. But they're throwing the baby out with the bathwater, unfortunately. So typical politicians. But anyway, and this has completely bipartisan support. So yeah. All right. Let's see here. I will turn 65 next year and don't plan on retiring because I love my job. Yeah, you and me both. Yeah. So, and making over 250. Well, I don't know about that. Anyway, so if I turn 67, I can claim full benefit Social Security and keep working and no need to sign up for Medicare. That is correct. In terms of the money, yes. You can wait till 67. That's probably your full retirement age. Yep. And then once you hit 67, once you hit your full retirement age, you can make $1 billion a month, and Social Security doesn't care, doesn't affect your benefits negatively. It'll improve them, but in terms of Medicare, you don't have to sign up for Medicare next year when you turn 65 if you have health insurance from current work, not a retirement plan or, yours or your spouse's. So if you or your spouse are currently working and you have health insurance from that current work and that group health plan has 20 or more employees, then yes, you're good. You don't have to sign up for Medicare. Some people do sign up for Medicare Part A. If you're contributing to an HSA, then I wouldn't, because you have to stop contributing to that HSA 6 months before your Part A starts. But if you're not, some people go ahead and sign up for Part A because it's zero premium anyway. And why do they do that? Because their health insurance from work has a high deductible. So if your health insurance from work has, you go in the hospital, if it's a $3,000 deductible, you pay the first $3,000. If you sign up for Part A, you'll save about $1,400 because Part A hospital deductible is only $1,676. So you pay that and you don't have to pay the rest. Medicare pays the other. So that's why some people, get Part A, but you refuse Part B if you already have health insurance from work. Yeah. All right. Let's see. What is the tax advantage of making a qualified charitable contribution for? Okay, yeah, I don't do taxes. So the petition doing good. Yeah, we've got about over 1,000 signatures on each of them. So I haven't checked today yet, but have applied for SSDI. I'm currently on long-term disability through an old employer. Will I have to repay my old insurance company when I get approved? Yeah, it really depends on between you and them. In terms of Social Security doesn't care about, long-term disability through an employer or something. The only time Social Security cares about something like that when you get approved for disability is if you're receiving money from like a workers' comp or a public disability, from the state or something. Then that offsets. But if it's just a private long-term disability thing, Social Security doesn't care. On the other side, your employer, you have to talk to them about that because they're all different. So, all right, let's see. I'm self-employed with a LLC, S corp. My salary is flat amount with the remaining income passed through entities. Since I don't pay as much taxes on PT, is it more beneficial to bump up? Okay, yeah, that sounds like a tax type thing. Um, that can be so frustrating that I've waited over 6 hours for customer service. Yeah, yeah, and again, that is a conscious effort by politicians to completely destroy customer service so people just say, "Oh, they're doing a terrible job." Well, it's like, yeah, it's like, go down to your local Starbucks and Starbucks decides to only put one person in that, that location, and yeah, you're going to get terrible service, but they're not that dumb, so they put a bunch of people to get you in and out as soon as possible. But politicians know that if they completely choke Social Security, then Social Security is going to provide terrible customer service, and you're going to get angry and just say, forget about it, give it over to Wall Street. So their plan is working, but we're smarter than they are. So people who work with a valid work visa in the US are paying into FICA, and are they eligible to collect benefits, or are they eligible only when they get green card or naturalization? Good question. Yeah, so there's this is another thing that the politicians do to trick us and divide us and stuff. And they say, oh, I would support Social Security, but they're giving all this money to illegals. No, they're not. You cannot get retirement or disability benefits if you don't have U.S. citizenship, or if you're not in the country legally. How do I know? Because I've adjudicated hundreds of thousands of claims, and when you come in and file for retirement or disability or something, you have to put the citizenship in there. You have to put the green card A number in there. You have to verify it through the system, through the INS, and if you don't, you can't move on to the next screen. So it's been estimated that just for Social Security, people that are in this country illegally, came across illegally from the south or the north, or came over on a student visa and never went back. They get a Social Security number legally or illegally, and they pay into Social Security. And it's estimated that they pay yearly about $37 billion. So thank you very much for the contribution. You're never getting that money back, unless, as Kayla points out, they do somehow become naturalized citizens or get their valid green card. If they don't, then they will never get that money, and it is a donation to us. So it is a beautiful thing. So when figuring Social Security, is it better to maximize both you and your spouse, or optimize for the total maximum? All right. So yes, good question. So you're probably self-employed. You have your own business and stuff, and here's what I've found. Um, People that have their own business, tax accountants usually mess this up. They know taxes, they don't know Social Security. I know Social Security, I don't know taxes. But tax accountants mess this up. They do your taxes and everything for you and your spouse. You're a couple that have their own business and stuff, and they divide it and do all the tax type stuff. But then when they do the FICA part, the Social Security part, they put it under one Social Security number. Okay. So all of the money is going to that one, which is fine if you know 100% for sure that you're going to be married forever. And you're basically, same age or so. The age is also an issue. But what happens is, people, life is what happens while we're making other plans. They get divorced later, and the divorced spouse goes to file for benefits and gets $300. And it's like, well, I work for a company, we're making hundreds of $1,000s a year, but yeah, your accountant put it all on your ex-spouse. And that person is younger, so you can't collect benefits until that person turns 62 and all the rest of it. So yeah, it really depends on the situation. If y'all are happy and you're going to be married forever and your ages are about the same ish, because one can't file for spouse benefits until the other one files if you're currently married. So yeah, that's a definitely a case by case. Let's see here. Sent an email to my senator about not listening to Louisiana senators. Yeah, the video I did yesterday was Senator John Kennedy from Louisiana. Kind of starting an internet myth about 6.2 million people receiving, did people receiving benefits, which he never said, but I think he was the reason he talked the way he did was hoping someone would pick it up on the internet myth, and they did. And I think he's partner. I'm almost certain. I'm not certain, but it's a coincidence that around the same time, his other senator from Louisiana is introducing the privatization bill that he wants to give $1.5 trillion of our savings over to Wall Street so they can do their thing with it and, take it to Vegas or whatever the case may be. And again, the irony just gets me is, all of these politicians saying, "Oh, the Social Security trust fund, it's not even there. It was stolen. It was given to illegals. It was given to Ukraine. It's worthless IOUs." But as soon as they want to give it to their buddies on Wall Street, it miraculously appears and it's real money. So, all right. Healthy 76 called chapter was stellar. Dev was awesome. Okay, yeah. So year of the age, so you can get an F, which most people can't nowadays, and you're healthy. Awesome. 50. So you save $56 a month. You went from a to a G. Oh, okay. Went with a G towards so pay off the mortgage sooner. Underwriting was a breeze. So you're exactly. Thank you for that, Mary. A lot of people think that, oh, I'm in my 70s, so I won't be able to get to a new Medicare supplement plan. I won't be able to get rid of Medicare Advantage and go back. No, that's not necessarily true. If you're healthy, doesn't hurt to try. And with a Medicare supplement plan, you can do that 365 days of the year. The whole, October 15th to December 7th thing that we just finished, that doesn't apply to you. If you're in plan F or a plan G or a plan N and you want to switch to another one, if you want to go from a G to a less expensive G, or if you want to go from a G to an N or an N to a G or whatever the case may be with a different company and save some money, check out some prices. Absolutely, you can do that 365 days of the year. The Part D, the drug plan that you also hopefully you should have. Yeah, that's limited to when you can change that. But the Medicare supplement plan, you can change that, any time of the year. So, but it's harder to go from a Medicare Advantage to a Medicare supplement. There's certain times of the year and stuff that you can do that. And we're coming up on, yeah. All right. But we'll talk about. I'll have Thomas here tomorrow to talk about all the gory details of that. Or if you can't join us, call up chapter there and they can see what's available in your area. If my ex-wife gets half of my benefits at 62, does that mean in my monthly benefits will be cut in half? Nope, doesn't affect. You won't even know. So if you have an ex-spouse that starts receiving benefits on your record, Social Security won't call you. So you probably won't even know. Or does that mean my total retirement runs out faster? Nope, no to that one as well. I've taken claims for people that were married 3 times, and each marriage was 10 years or longer. And, you got 3 spouses collecting benefits on one record, and it doesn't reduce any of them. One doesn't reduce the other. The other one doesn't know. Could you imagine that? It's like, oh yeah, she was married to a new guy, and now my benefit is because this new guy came on, and so yeah, that would be interesting soap operas, wouldn't it? Yes, please don't forget to hit the like button and stuff. That's how we get this information out there. Let's see. All right, looks like a type of IRS question. I'm going to jump that one. I'm turning 65 in March 2025. I won't know which Medicare is best. Which one would you recommend as a single mother? But I also would like to stay with Medicaid if possible. Okay, so if you're on Medicaid, you cannot get a Medicare supplement plan. Um, so, yeah, you'll be a Medicare Advantage. And So you're 65 in March. So all the plans are out for March, for next year. So you can call chapter today or in January or whenever the case may be, and they can look at your particular area. And nobody can tell you which plan is best in your area until they ask you a bunch of questions, like what doctors do you want to continue seeing? What are your prescriptions? Do you go to the hospital often? Do you do MRIs? Do you need dental, vision, hearing, all that kind of stuff? And then because there's dozens and dozens and dozens of plans in your area, um, and unless you live out in the desert someplace where some places don't even have Medicare Advantage plans. But yeah, they'll ask you a bunch of questions and then they'll find the best plan for your specific situation. So don't, you know, oh, my next door neighbor likes this company. Okay, well, that's great for that person. Maybe they have different doctors and different needs. It's always individualized, always. And a lot of people don't know that, if you have a Medicare Advantage plan in, whatever area you're in, that particular company probably has 5, 6, 7, 8 different plans. So people say, "Oh, I like the company I'm with." Okay, well, fine. Just update to one of their newer plans with more benefits and, more savings and stuff. So, and again, you'll have another opportunity to do that in January. It's a kind of a one-time, a one-offish type thing. Okay, somebody answering somebody else's question. I appreciate that. I retired from the state of Texas years ago. I still get retiree insurance. Do I still need to sign up for Medicare when I turn 65 next year? You'd have to reach out to the state of Texas, your HR there, your retirement department, and find out. Normally, yes, because um, yeah, the state wants to save money by moving cost over the federal government. Even though it's Texas, like it's the Texas Republic Party. It's not a republic, but the Texas Republic. They wanted to be their own state again. That's why the Lone Star, right? So Texas always wants to be its own state. And they hate the federal government unless there's money in the federal government that they can get. And so probably your state of Texas HR will say, yes, you have to get Medicare because we like federal government money. Why do I know everything about Texas? Because I went to high school in Paris, Texas. So there's that. Request for IRMAA reduction approved, but instead of 2024 income reduction due to the spouse stopped working October 2023, Social Security is going by my 2023 IRMAA. I paid for 2021, which is due to capital gains. Why? All right. So they do that every year. So for 2025, they go by your 2023 earnings. And for this year, they go by 2022. They always take whatever you made, whatever you and the IRS decided, you made for that particular year. It's line 11 and 2A of your tax return. Those are the two lines they look at. They add those essentially together and determine how much your IRMAA is going to be. But they do it every single year. And people are getting the letters now that for 2025, here's how much your IRMAA is going to be. For those who don't know, that IRMAA is income related monthly adjustment amount, and it's a higher premium for high wage earners. But if you have since stopped working or get divorced or have what's called a life changing event, then it's a form SSA 44, and you have a life changing event that sure you made over 103,000 or 206,000 last year, but you have since stopped working and they should readjust it. So um there are more than plans G or N. There's a plan C, like the questioner asked. Yeah, there's but most time it's people thinking Medicare, Medicare Part C. There are 10 letters, but the other ones are, yeah, the other ones are pretty terrible, if you ask me. They have a really high deductible. They don't cover anything. They only cover 50% of this, and yeah. But yeah, it's most people when they ask that question, they actually mean Medicare Advantage, Plan C, Part C, excuse me. All right. Got IEDS, thanks. But I got this letter saying we are withholding Social Security benefits for August 2023 through November 2024. Are they trying to keep my back pay because they gave me the wrong info for years? Should I appeal? Okay, so yeah, the IEDS is independently entitled divorce spouse benefits. And it's basically what it is. If you start your benefits, retirement benefits, 62 or beyond, and you have an ex spouse that you are eligible for benefits off of because that person's benefit amount, their full benefit amount is twice yours, and you were married to that person for 10 years. And for the independently entitled divorced spouse, you also have to be divorced for 2 years. So if all of those things apply, you can file for benefits. And what it makes it independent is that that person doesn't have to have filed for benefits. There's a lot of people out there. So please plus like and subscribe and all that kind of stuff. There's a lot of people out there that are missing money every single month because they're sitting around waiting for their ex-spouse to file for benefits because they think that, well, I can't start benefits until that person starts their benefits. No, that is incorrect. As long as that person is 62 years old, you can file. That's the independently entitled divorce spouse benefits. So it sounds as though they got that, but then you've got some type of overpayment or situation. Yeah, that not sure what kind of situation you've got there, but yes, if you disagree with it, 100% appeal it. That is an SSA 561. The 561, it's pretty easy to fill out, but they only give you like 2 or 3 lines to fill out your story, what you're arguing. So just write see attached and then attach a letter with, whatever your argument is. Send it to them. Make sure you get a copy of it. Make sure they stamp it that they received it, initial it, and then keep that copy. Right? Is it true that those who make over 168,000 don't pay into Social Security and still collect Social Security? Yes. What kind of bull is that? No wonder why Social Security is going bankrupt. Yeah. Yes. 168,600 is this year. It's 176,000 next year. But yes, after that, they do not pay into Social Security FICA tax. They do pay Medicare. So there is no cap for Medicare. Actually, after $250,000, they pay a little bit more for Medicare. So people say, "Oh, it's not fair." Well, they've been paying, every single penny for Medicare for a long time, and the world hasn't come to an end. But it's the golden rule, right? It's those with the gold rules, and they don't want to have to pay, you know, their FICA like the rest of us on all their income, like the rest of us. So they're going to fight us 100% on that one. So we need to get activated. I've been on Social Security disability since 2006. Now in March 2025, will I just go to Social Security retirement? Yes. If you are coming up to your full retirement age, if March 2025 is your full retirement age, 100%, you'll switch from regular disability benefits and they'll switch over to regular retirement benefits. And you won't even know the switch. Your benefit amount will be the same. Your check, direct deposit will be the same. But you no longer have limitations in terms of work. You can make, you go back to work, make $1 million a month. And you don't have that CDR anymore, the continuing disability review. You don't have continued disability reviews anymore. So now you're free. I no longer get Medicaid, but I do have Medicare. My automatic extra help for Part D was dropped, so I sent in my extra help form for Part D prescriptions the end of October. I haven't heard back yet. Okay, yeah, so this is what they're doing throughout the country. They're redoing Medicaid, and it looks like the next administration is going to go after Medicaid as well. And yeah, a lot of people are being kicked off of Medicaid, unfortunately. Um, but if you disagree, and a lot of people are getting kicked off Medicaid incorrectly. So, but if you get a job or get a inheritance or whatever the case may be, and for sure that okay, because Medicaid is a welfare-based program, low income, low resources. If 100% for sure, oh yeah, they kicked me off correctly, then it is what it is. But if you don't think they should have kicked you off, then you appeal the decision. But another thing that people forget about is if they had Medicaid and Medicare, remember when you have Medicare and Medicaid, you're eligible for Medicare Advantage dual eligible plans. You have to have a upper levels of Medicaid. There are several levels of Medicaid depending on your state. So you have to have the upper levels of Medicaid. But if you have that and Medicare together, you're dual eligible. You have both, and you're able to get a Medicare Advantage dual eligible plan. And those are the ones you see, advertised all the time, kind of a scammy advertising where they say, hey, $6,000 of grocery cards and free ice cream and unicorns and whatever. Um, those cards do exist, but the way they advertise them is really, really scammy. Um, they do exist. They might be available in your area. Reach out to someone, reach out to chapter, and they'll see if there's available in your area. But if you're losing Medicaid, you also are going to lose that dual eligible plan. So it's important that if you lose Medicaid, you shop around for another Medicare Advantage plan, a regular Medicare Advantage plan, that one that works for you. And you can do that any time of the year because you lost Medicaid. So reach out to your insurance agent or broker, or again, call chapter, and they can help you out. But it's important that you do, because a lot of people, they lose Medicaid, but they still got their card, and they say, well, I'll just continue using this card. And then they go to the doctor and something happens, or they get an accident, and guess what? You're stuck paying it because that has been canceled because you lost Medicaid. So, all right, let's see here. Okay, got that one. Got some. Ed, can you explain in detail how qualified Medicare beneficiary savings program works and it relates to Medicaid? Okay, I knew you were going to ask that. That's why I just answered it, right? So yeah, a QMB, that's one of the levels of Medicaid. Is so you have the QMB, and some states have a QMB plus, and then you have the QI, the qualified individual, and then you have the SlimB, and yeah, there's all kinds of different variations depending on the particular state. But a QMB, that's one of the higher levels there. So that means if you have that Medicaid, you also have Medicare, you're able to get those dual eligible plans. And the QMB and the QI, and some states the SlimB, they also pay for your Part B premium, and that's called the Medicare Savings Program. So if you know anybody out there that is having a hard time, getting by on a monthly basis, and they're paying their Medicare and they're paying that $185, it'll be $185 in starting January. Tell them to reach out to their Medicaid office in their state and ask, you know, say, hey, pay for my Part B premium, please. And they'll sign you up for Medicaid. And if you're eligible, you'll get the Medicaid. You'll save yourself $185 a month. You'll get more of your healthcare coverage covered. And maybe there might be one of those cards with the extra money on there. And yes, and Part D. If you have that, usually you're also qualified for Part D, which is the the extra help for Part D, the extra help with your Medicare prescription drugs. It's also called the LIS, low income subsidy. And there's changes for 2025 in that. That's one of the reasons this Medicare season was the craziest we've had in decades, is because next year they're changing Part D, and now there's a maximum out of pocket of $2,000. Up until now, like this year was like $8,000. So if you take a lot of prescriptions, you have to pay the first $8,000. Starting next year, you only have to pay the first $2,000. And there's a new program. It's called smoothing. So you call up and say, smooth me, basically, I guess you call up your Part D plan or whatever. And it's basically, if you have a really expensive prescription drugs that you have to pay $2,000 a month for, and you're like, wow, okay, I only have to pay that 1 month, but still that 1 month is tough. That $2,000 I have to pay in January, and I have to cough up $2,000 in 1 month. Call up and say, smooth me, because what they can do is they can set you up on like a payment plan type situation where you don't have to pay $2,000 in 1 month. You can be smooth for the entire year, and they'll charge you a little bit for each month for the entire year. So please, if you know anybody that is having difficulty, tell them to reach out, and yes, get that taken care of. A friend of mine worked 35 years for the FAA. He doesn't get Social Security. He said he gets something else. Is that also true for state and local pensions? Yes, those are called. So for the FAA, for old federal employees, there was called the CSRS, the Civil Service Retirement System. And that pretty much, they stopped getting new people in that in the early 1980s. So in my office, we had close to 100 people, and only one person was left under the old system. The other 99 people were under the new system, and they pay Social Security. So there's still a myth that's out there that politicians and federal workers don't pay into Social Security. That is incorrect. If they were hired in 1973, like this person was, she's retired now though. Yeah, she didn't pay into. She has a separate system but because she didn't pay into it, she doesn't get Social Security, but they have a separate system. Yes. But everybody pays into it nowadays, except for about 3% of there's Texas teachers and firefighters and LA teachers and Chicago and Florida. So there's about 3% of people that work for government, local and state government entities that do not pay into Social Security. And that's that Social Security Fairness Act that is being passed, which is 100% unfair. But hey, all right, let's see what else we got here. 4 years, total 7,500 out of 23 years of contributing to a forced non-Social Security retirement account, and 17 years out of 23. Oh, okay, so the CalPERS, yes, CalPERS is one of those as well that doesn't pay into Social Security. But it's interesting that CalPERS, I've seen some jurisdictions in California that do pay into Social Security. Yeah. All right, so let's see here. All right, asking the same question. Does chapter charge a fee? No, they do not. No place that is going to help you sign up for a Medicare plan, a Medicare Advantage, Part D, Medicare Supplement plan. No place should charge you to help you sign up for it, to shop and sign up for one of those. No insurance agent, broker, company, and if chapter helps you out, or your old high school buddy, that does Medicare insurance, you pay the same exact amount, a monthly premium and everything. So um, they chapter and everybody out there gets paid directly from whatever health insurance company you pick. So if you pick, company X or Y or Z, then they pay them directly. And if you say, well, I'll just cut out the middleman and go directly, it's still the same price and everything. So it's always good to get that extra help. And the great thing about chapter is why my son and I look throughout the country for some place to help y'all with Medicare. Why we chose them is they look at every plan, and they look at every plan in your area and give you all your options. They help everybody, all 50 states, and they've got an awesome, what they call it, member success team, where if you need to help finding a doctor, or you have an issue with prior authorization, or you get in a bill that you don't understand, you call them up and they help you out. So that's one of the things that kind of slam dunked it. And the fact that the CEO, the guy that started it all, used to support the Marines on Okinawa, and I was a Marine on Okinawa, and a few years before he was. But anyway, young people. Years ago, I started asking about spousal benefits and got wrong info. Now, because of you, I got IEDS. Yeah, no, because of Penelope and Take and Took and Nobody Cares and thereafter. Yes, it's all the people that press like, and that's why you got this information. So we got an awesome community here. But I have a letter stating there withholding Social Security benefits for all. Oh, okay, so that's the same question. So, because of SSI. Okay, all right, all right. So that makes a little bit better sense there. So number one, awesome. But yes, anytime you're on SSI, and SSI is the welfare-based program, the supplemental security income. It's not paid by the Social Security Trust Fund, Disability Trust Fund, Retirement Trust Fund. That SSI money comes out of the general taxation. So it's a welfare-based program, low income, low resources. Anytime you receive SSI, if you're eligible for any other benefits in the world, you have to file for those benefits. And what they do is they offset. So if you're entitled to, in your case, spouse benefits, an extra $200, then they say, hey, you should have filed for that years ago. But in your particular case, you asked, and they told you weren't eligible because the person at the Social Security office, as unfortunately I'm seeing, is giving out incorrect information. I tell people about the IEDS all the time. They go down to the local Social Security Administration, and the person at the front window say, no, you're wrong. Dr. Ed doesn't know what he's talking about. He's an idiot. Well, yes, but anyway. And then I have to give them the policy reference, and they go back down there, and the person looks at the policy reference, disappears behind the wall for about 5 or 10 minutes, comes back with a sheepish look on their face and say, yeah, you're right. Come on back. We'll give you some money. So in your particular case, though, yes, they are offsetting. They're saying that you should have filed for benefits, but you did, and it's not your fault. So in your particular case, I would, get the money. Obviously, hopefully your check is started. You get the decision letter of the overpayment or the offset or whatever the case may be, And in your particular case, I would try it. I'm not sure it's going to work, but it doesn't hurt to try. Um, File a request for reconsideration and say, "Hey, um, you know, I try. You're withholding that money. You're offsetting that money from my SSI. And okay, yes, I understand that, but it's given me, this is a hardship right now because I should have been receiving that benefits for, what, 2, 1, 2, 3, 4 years. And the reason I didn't is because you guys gave me wrong information. So because you gave me wrong information, you're putting me in kind of a hurt locker now. So do the right thing and, forget this offset, forget this overpayment or whatever the case may be. So I would try that. An SSA 561, and again, attach a piece of paper, tell them your story. It says, "Hey, I did the right thing. I called. You said I couldn't, and I went on with my life." So I would definitely try that, and then come back here and let us know how that works out. Oh my gosh! Wow, wow, big. Thank you very much for the wow. I got my coffee IV for the rest of the month. The last time I was contacted by my SSA in Manila was in October and said my benefit will start from September. They told me that SSA US will contact me. I've not heard from them. Wait or call. Please compact this for me. Um, yes, the problem with the federal benefit units throughout the world, the one in Asia is in Manila, and they've got a new person over there. My old buddy Jason, he is transferred out, but they got a new person there, and the problem with them is they've only got one person in all of Asia, and then they have people that work in the American embassy, you know, consulates and stuff throughout Asia, but they are not Social Security people. They're taught a little bit about Social Security, and they take the claims and then they send it to the OIO in Baltimore, the Office of International Operations. So yeah, it's a nightmare. I always, always, always recommend, if you're going to do something like that, do it before you leave the country. Go to your local office in the United States, get it done, and then go, expats wherever you're going throughout the world. But that's too late for you. So I would, yeah, the federal benefits unit and the OIO is taking forever to do things, unfortunately. Well, every office is because they're inundated. But in your particular case, I would, as I recommend everybody do, contact your senator, congressperson back in home where you're from. Go onto their website and put down there, "Hey, there's a little button that should, I need help with a federal agency." You type it in, what your issue is. And I always recommend everybody also say, include in there, "Hey, what are you doing to improve customer service at your local Social Security office?" But you need to do a congressional, and that's called a congressional, is to get Congress involved. And what will happen is that will go through Baltimore, back in Baltimore where the headquarters is. It'll go to the regional office, it'll go to the district office, and your local district office or the federal benefits unit or the OIO will have to jump on it and respond back to that congressperson within 24, 48 hours. So that will start everything going a lot quicker. So I recommend everybody, if you have a situation like that, and anytime you reach out to your congressperson and say, "Hey, I got this issue," always add on there, "And by the way, okay, I don't care what you do with other office throughout the country. I care about what you do. You're my representative. You have an office, a Social Security office right down the street from you. Do you know there's a 3-hour wait? Do you know it takes, 9 months to get a disability claim? Do you know they lost the paperwork here? Why aren't you helping that office help me? I paid for help. Why aren't you giving Social Security Administration those resources to help me?" And they'll say, "Well, for fraud, waste, and abuse," or they'll come up with some anyway. So, all right, that's it for today. I'm over time, and unfortunately, more questions. I'll be back again tomorrow with Thomas, and we'll talk about all the things about Medicare, so you don't get penalized for